So welcome, everybody. Thank you for our actual first live presentation from our mental health task force. My name is Bonnie Minjin. I'm a supervisor of pupil services for the Cherry Hill Public School District. We have a wonderful panelists that joined us this evening, experts in the community. We have a presentation, a PowerPoint presentation that they will go over. And then we'll have time at the end for questions if you want to ask specific questions to our panelists. And then we'll have an interactive conversation. So let me go ahead and share my screen.
Well, hi everyone, I'm Jackie Bramble and I'm the Associate Director of Marketing for High Focus Centers. So I'm excited to tell everybody about our services and who we are as a treatment organization. High Focus Centers has been around for a really long time, for over 2 decades, and we are a part of Pyramid Healthcare, and we are the largest outpatient provider throughout the state of New Jersey. We do have a location in Cherry Hill, so right in the community. And while most people attending this presentation tonight, I'm assuming are parents of adolescents, just as members of the community, I think it's important for you to know that we also provide treatment for adults as well. So we provide treatment for ages 10 and up. We have a middle school age population program. We also have an adolescent program and of course our adult programming as well. We treat for primary mental health, and we also treat for primary substance use disorder, and that is for both adolescents and adults. The levels of care that we provide are called partial hospitalization and intensive outpatient. And what this means is these levels of care are generally the most amount of outpatient treatment someone can receive on an outpatient non-residential basis. So it's really ideal for somebody who is struggling and maybe they have tried a once a week outpatient therapy and they've seen limited to no success. We would be the next appropriate level of care. So we provide a very comprehensive program to really target stabilization overall. So what our treatment and those levels of care comprise of is, while it's primarily group-based, we also incorporate in individual therapy, as well as individualized family therapy and a multifamily group. We also have psychiatry, and those that are coming to see us for mental health symptoms, they're seen by our psychiatrist within 48 hours of starting the program. And if it's recommended to be placed on medication or have medication changed, we monitor that very closely. Our psychiatrists do med management checks with those that are in our program once a week throughout the duration of treatments. Bonnie, you can move to the next slide. Thank you. So as I mentioned, with our levels of care, the primary needs that we see are, again, for mental health and substance use disorder. I'm very excited that we have launched a great new program. We launched this actually just a few weeks ago on March 1st. So we now offer an LGBTQ plus track that we call Treatment with Pride. And this is available for both of our adolescents and our adult populations. And so what this means is that, again, the person would need to meet criteria for the levels of care that we have. And those levels of care are mostly still integrated. However, in lieu of 2 of the integrated groups, a person could be in this carve-out track that we have. And so this is just a great opportunity to be able to be in a track that creates affirming treatment, a safe place, and really have that acceptance over authentic self. And so what this track consists of is 1 process group a week and also 1 psychoeducational group a week. And that psychoeducational piece, it's based on a 12-week curriculum. That doesn't necessarily mean that a person is in our program for 12 weeks, but it's created that way so that if someone is with us for that long of a duration, nothing becomes repetitive. And it's through that psychoeducational piece that we're really able to target certain topics that hold a lot of weight for the LGBTQ plus community, such as really looking at disclosure hierarchy. Who do I come out to? Who is safe for me? Who do I create boundaries with? Also looking at empowerment and using this track as a tool for empowerment, as well as looking at advocacy, microaggressions, and minority stress. So we're really excited to now be offering this program at our Cherry Hill site. Bonnie, if you don't mind going to the next slide for me. So as I mentioned earlier, we have a number of locations and they're all across the state, but our intake department is centralized on behalf of all of our locations. So if you're looking to set somebody up with our Cherry Hill site, I have placed the main centralized intake number on this slide to take note of. Our intake department is available 7 days a week to receive that call. Their role is really to collect that preliminary information and get the person set up with the assessment appointment. I do want to mention that while under normal circumstances, we operated fully on site, a year ago when the pandemic hit, we had to pivot very quickly and move all of our services, including our assessments, onto our HIPAA compliant telehealth platform. So over the last year, all of our services are accessible via telehealth and still are. Eventually, we will integrate more of a hybrid model, but it has been very successful doing it this way. We've seen, we track our data very closely. We've always tracked data to really keep up with holding ourselves accountable to clinical excellence. And we've seen really strong outcomes with the data that we've collected, and in terms of levels of engagement and symptom management with our levels of care and being able to access it through the platform. So I will be available later in the presentation if anybody has any questions pertaining to high focus centers and the services that we provide.
Thank you, Jackie. So next we have Penn Medicine, Princeton House Behavioral Health. Our presenter will be Michael Redfern.
Thanks, Bonnie. Just a quick little housekeeping note. If you click, Bonnie, on that slideshow at the top, that will allow the slideshow to be a full screen. And then you said start the slideshow. Yep, it should be click all the way to the left.
There.
And then if you can use the up and down buttons to progress through. There you go.
Thank you.
You bet. I guess, after being on Zoom meetings for an entire year, we learn all these little tricks. So. Oh, thanks, Bonnie. My name is Mike Redford. I am the community representative for Penn Medicine Princeton House Behavioral Health. Some of you may know us as just Princeton House. About 2 years ago, Princeton Healthcare merged with Penn Medicine. It's been a great opportunity to get additional resources for treatment and to just be a part of a quality hospital system. So we're very excited what this has meant for us. Jackie did a great job talking about high focus. We certainly work in many ways together because we treat at about the same levels as high focus. And Princeton House has been in the community for about 20 years. We started in Cherry Hill, and about 6 or 7 years ago, we moved to a larger facility in Morristown. Princeton House has been around for 50 years. This is our 50-year anniversary. And so we're proud to have been a big part of the treatment community in New Jersey. And we've worked very closely for many, many years with the Cherry Hill School District. I don't know if parents on here have heard about, maybe a decade ago, there were a number of suicides in the high school. And we worked closely with East and West to get kids into treatment, to address the emotional needs of kids in the schools, and you know, we've been affiliated and connected to the school district ever since. Bonnie, next slide. Princeton House has an inpatient facility in Princeton, and we have 6 outpatient sites throughout New Jersey. As I mentioned, the one in Morristown is the closest one. And we also treat adults and adolescents and children. So if you go to the next slide. Our outpatient group therapy is also group-based, and we provide intensive outpatient therapy, which is a lot like if you are seeing a one-on-one therapist in the community, and it seems like that's just not enough for the individual. More treatment or more therapy is needed, and that's where we often get referrals from therapists for their patients to get them admitted into our intensive outpatient treatment tracks. And as Jackie mentioned, we also did a big pivot to telehealth in March of last year, and we were all nervous about how are we going to do group therapy in the same kind of format as we're doing tonight. And we found that it's been very effective. So we're very, very pleased to say that the telehealth format that we use has been great to get people engaged. They're seeing their psychiatrists and their nurses. So it's been a real positive effect. We certainly are excited. We're getting back to our in-person treatment as soon as we can, as soon as it's safe to do so. Our intensive outpatient tracks are 3 hours a day and 3 to 5 days a week. So when someone is referred to Princeton House, the first person they're going to interact with once they have had an evaluation scheduled is their evaluation is done by a psychiatrist. We have 8 psychiatrists at our Morristown site just alone. So there are a lot of psychiatrists in the Penn Medicine Princeton House system. We feel very strongly about having the patients see their psychiatrist at least weekly. Our child and adolescent programming, again, is also group counseling, and it runs from 12:30 to 3:30. And again, it's either 3 or 5 days a week based on the criteria that's determined by the psychiatrist during that initial evaluation. Bonnie? We have different tracks for our outpatient programming. We have a child psychiatric program that runs from ages 6 to 12. Sometimes people say to me, I can't believe that kids need this level of care. And it is unfortunate, but we do see a number of children who are already experiencing suicidal thoughts and maybe self-destructive behaviors. And those are the kinds of kids that we work with. We're trying to help them improve their self-control, their coping ability, really stabilizing them to make sure that they're functioning well at home and in school. Our adolescent programs run with from adolescents 13 to 18. If they're still in high school and they're 18, we'll certainly put them in the adolescent track. Within the adolescents, we have a psychiatric track, we have a co-occurring disorders, and we have a DBT track. The psychiatric track is for teens who are experiencing depression or anxiety or other mood disorders that are becoming very problematic. A lot of times we work with the crisis units. When kids have to go to crisis, they often send them to Princeton House or another facility to get more intensive treatment. The co-occurring disorders has to do with those same teens who are having psychiatric issues, but they're also experiencing substance use disorder. They're using marijuana or pills or alcohol. And so that track addresses those behaviors as well. The DBT is a form of therapy called dialectical behavioral therapy. And Princeton House has been on the forefront of using DBT to treat people who have difficulty who've been through a lot of therapeutic intervention, but don't seem to be making progress. We started the DBT tracks with our women's trauma programming, and all of our staff became certified in this treatment modality. And we saw so much progress and so much success with the women that we decided to open that up to the adolescents as well. And so we have treatment, we have therapists who are now specializing in DBT with our adolescents. It's really working on a mindfulness approach to regulate emotions, and it's a very skill-based way to treat people. So we're finding that they really do like it. They're progressing, and we see a lot of success. We do take all private insurances as well as Medicaid, and for adults we take Medicare. We work closely with first responders and the military, so we do take TRICARE. So there typically is not an issue with insurance. And they're with us typically for about 6 to 8 weeks in treatment. As I mentioned, we have psychiatrists, we have nursing staff, we have the social workers who run the groups. We like to call it an interdisciplinary approach to treatment. At the end of that treatment time, we invite each patient to fill out a questionnaire about their time at Princeton House, where they can write down what they like the most, what they like the least. And at the end of that, at the end of every month, we read in our staff meeting all of the feedback, and it's always very impressive to me, the kinds of feedback that we get from our patients. I just picked out one here that was from an adolescent. It said, what did I like the most? It was the attention spent with my individual needs, the diversity of education and treatment, and especially my art and music therapist. So, you know, when I talk to people in the community and they say, you know, I don't really want to go to group therapy, I say, give it a shot, give it a try. People really do enjoy group therapy. They end up really liking their treatment at Princeton House. There's art and music therapy as noted, and they really do make some progress. So I'm going to put our admissions number in the chat, just so you know, it's 888-437-1610. And I appreciate being a part of this presentation tonight. Thanks.
Thank you, Mike. So next we have Assistant Fire Chief Ken Baum, who's going to talk about the resources from the Cherry Hill Fire Department.
Thank you, Bonnie. Yes, my name is Ken Baum. I'm one of the 2 assistant fire chiefs. There's really 2 main portions of the Cherry Hill Fire Department. First is responding to 911 phone calls, of course. So the department is very busy in those areas. We have responders on duty 24 hours a day, 7 days a week, with 4 engines, 2 ladders, a battalion chief, and 5 ambulances. So we are doing about 11,000 EMS calls a year and about 4,600 fire runs a year. The other major part of what we do is what we call risk reduction. It is our desire not to go to 11,000 EMS calls a year and 4,600 fire runs a year. It would be our desire to not to go to any of those. So how do we effectively do that? So what we do is we partner with other agencies to work with that. We work closely with the Cherry Hill Police Department, also our Office of Emergency Management, and the school board. And so we have a series of things that we work through with our public education, the social media, and those type of things. So we'll see, the first thing is that we do public safety presentations. We do have an elevated risk of senior citizens in our town. We have a lot of long-term assisted living facilities. So we do focus on those who are elderly in their homes. So we do focus on the seniors. And we also work closely with the civic groups, church groups, and as I mentioned, the assisted living facilities. We try to prevent fires by doing inspections. So our fire marshal's office is actively getting out into our businesses and preventing fires by doing inspections. And then part of it is conducting fire extinguisher demonstrations and training. We look at, we work with the local business if they have a desire to have fire extinguisher training, we provide that. The school teachers, school board, and also our public work personnel. So, you know, if one of their vehicles catches fire or they have a fire in their garage, we work with them through that. Okay, Bonnie, you could move on to the next. As far as what we do with schools, I think we can all look back at our fond time that we had when we were younger, when we were in school and the fire engine came or the ambulance came, and we would kind of get excited. We would go outside for that. We still do that. The kids love it, and they do learn something. So at the kindergarten age, our firefighters, this year we struggle with it a little bit because of COVID, but normally we visit the kindergarten classes and the firefighters get to visit the school. They do stop, drop, and roll. They show them the fire engine. The firefighter gets dressed and not to be fearful of the firefighter. So we work with them in that. The children that are in the 1st, 3rd, and 5th grades, our public education officer works closely with the teachers to be able to teach a program. And what better is than to have the teacher teach it? The teachers know the students. They have the ability to teach. So we provide the curriculum for them to be able to teach fire prevention and safety of all kinds of different things, from making sure they wear their bike helmets and things like that. The 7th and 8th graders, we do have our public education officer, which is Tammy DeLuca. She does visit the schools, the middle schools, and does the fire prevention education programs. During the time of the season in which we have the proms, we have 3 schools, Cherry Hill East and West and Camden Catholic. We do visit those schools. We talk about drunk driving. We do a program, a presentation with a vehicle, which we put the students inside. We cut them out of it as if they were in a motor vehicle accident. It does impact them. Of course, our desire is for them to not to be drinking and driving, to conduct themselves safely during prom time. There are alternatives to having fun. So that's one thing that we encounter as to helping to reduce the risk in town. Okay, Bonnie. Next, the smoke detector program. Smoke detectors are available to all our seniors. We will come to the house, we install the smoke detectors. You're eligible up to 3 smoke detectors, a minimum of one on each level. Of course, we encourage you to check that monthly, change your clocks, you change your batteries. I'm not always the best at this in my house, and I think we'd all have to admit that we need to make sure we're diligent in that. The other thing is having a carbon monoxide detector in your home. At minimum, you should have one in the presence of your bedroom, in the area of your bedroom, in the common hallway to start, and then one on each level. We do not provide carbon monoxide detectors as a homeowner, or you'd be responsible for that, or as a tenant. We do respond to emergencies, unfortunately, and we've had fires in homes in which there still are no smoke detectors in their homes. It's kind of hard to believe this late, and as they've been around for so long, but we still see it. And it's really sad that people could lose their lives or have an advanced fire because they did not have smoke detectors in their home. Okay, Bonnie. This is a little drawing diagram of where you should place your smoke detectors, of course, one on each level. Keep it a minimum of 6 inches or so from the wall or the ceiling. So we can provide more of that information for you. And I think, Bonnie, the next one is, I think, close to getting last. Okay. Unfortunately, we do have fires in our town. Some of them are a little bit more significant. So we do a neighborhood follow-up. So if there's a fire in the town, in your neighborhood, we will canvass the area, knock on doors, provide smoke detectors as needed. We do deal with juvenile fire setter program. We do have juvenile fire setters. Unfortunately, the stress sometimes, or mental health and some other things that play into that. But we have a countywide program that we lead. We work closely with the county for youth that are any youth between 4 and 18 years of age. We provide fire safety education. We also provide family and individual therapy, and we could relate that to others to programs. The last one is, in fact, I have one here. It's called A Vial of Life. Inside of it, it's a program. Inside of this little, looks like a pill bottle, there's directions and there's 2 stickers. The purpose would be for you to fill out the form inside. You put it inside of this capsule. Inside of the capsule goes into your refrigerator, preferably on the door. And you put a sticker on your front door and on your refrigerator with your history of your medical condition. So when we respond to your house for a medical emergency, we'll be able to, if you're not responsive, they'll be able to, emergency responders will be able to determine what your medical history is and be able to treat you appropriately. So if you'd like one of those, you need to pick it up at the Fire Administration Building on Laurel Crest Road or Fire Headquarters. Okay, Bonnie. We do run a babysitter program in which for ages 12 to 16, guys and girls, we teach them CPR. We teach them also how to be a babysitter, and you get a certified babysitter certificate. Monthly, we also, second Friday of the month, we also do a car seat. So if you have a car seat for your child and you want it checked, you can come by and do that. Again, it's all part of reducing risk. Okay, Bonnie. And lastly, I would just encourage you to go to Cherry Hill Fire Department website. There are a lot of great things there that you could see there. And also, there's the phone number. It's 856-795-9805, and you can press 5 for the public education officer. If you would like to have, if you have a concern about juvenile fire setter, if if that's something that you feel like you're doing within your family, she can help you with that, or any one of those other public presentations. Thank you very much.
Thank you, Ken. It was very informative, especially about the vials with the medicine on the refrigerator. Next is Assurance Behavioral Health Care by Dr. Harry Green, and his wife, Regina, is also a nurse practitioner who also works in the Assurance Behavioral Health Care, as well as other things that she will also describe. So Dr. Green and Regina.
Hi, everybody. So I work as, I do community outreach with Assurance Behavioral Healthcare, as well as we'll be starting up doing some therapy again soon. I'm also an assistant professor of nursing at Stockton University, and I teach psych mental health, as well as do clinicals in the community at a number of different hospitals. And so with that, I'm going to turn it over to Harry, because he's going to talk a little bit about the practice.
Okay, so I am Harry Green. I'm a clinical psychologist. Besides living in Cherry Hill, and we've had three kids go through the system, or at least 2 are still in the system following in my footsteps. Woodcrest Elementary, Beck Middle School, and Cherry Hill East. A little shout out to them, which is where our kids are going. I've been in Cherry Hill since before Vito's Pizza was Vito's Pizza. It used to be an Arby's, for anyone that goes back that far. So a little bit about our practice. It's it's an outpatient practice. I believe now we have 10 clinicians that do therapy, and those clinicians are kind of represent kind of the diversity. Maybe it would be nice if Cherry Hill had more diversity, but it has some, and so does our practice. So men and women, persons of color, LGBTQ plus, the kind of wide range of folks who are providing therapy. And I think that that's just important, because one of the things that, the research would suggest that one of the things that makes a therapeutic relationship work. It's just the nature of the relationship. So we try to make sure that we have kind of what people need out there. And we accept most insurances, and morning appointments, night appointments, weekend appointments. And, with telehealth, if there's been one of those things that's been, I think, a positive of this pandemic, though I must admit, I think we're all pretty tired of it now, is, just how telehealth is being more widely utilized. And that's certainly been the case at Assurance Behavioral Healthcare. And so we hope to continue that, just from the point of having greater access to mental health services. What else? One thing I think that's unique about what we do is also we have now 4 psychologists who do therapy, but also do a fair amount of psychological testing. One of the large areas that we do testing is for the legal community. But as it relates more to kind of the school setting, risk assessment, sometimes kids say and do things that cause others to wonder about what risk they might pose to other students. And we use psychological testing and assessment to sort of in an objective way offer some idea about how that student is doing and under what circumstances and what risk they might pose. We also do some school-based testing, intellectual functioning, and achievement testing. And I think, Bonnie, you could probably just go to slide 3, and I'll just very briefly touch on, the basics of some of the issues that we see in adults, adolescents, and children. 2 of our therapists are family therapists. Mood and anxiety disorders, bereavement, trauma, do a fair amount of couples counseling and family counseling, and anger management. And if I could just, so our telephone number 856-528-2207. Website is assurancebh.net. And, we try to be really open. I mean, we're certainly expanding, but we're still a local Cherry Hill practice. And so I would just also like to give out my cell phone if anybody ever has a question or needs anything as it relates to your loved one or yourself and how you're doing. My cell phone is 856-905-3732. That's 856-905-3732. All this has been great information, and I hope you find this useful. And that is all from Assurance Behavioral Healthcare.
Okay. Thank you, Regina. Did you want to add anything? Or you?
I was just going to say I wanted to have him sort of focus on the slides, but I think to Harry's point, having growing up in the area, I didn't grow up in Cherry Hill. I grew up in one town over, but I think being a part of the Mental Health Task Force Committee and hearing from the counselors and the teachers and all the wonderful folks that are a part of the committee and yourself, and also having children in the school district, we recognize some of the things that we hear and see. And I think we try to incorporate that into the practice, as well as, just as Harry said, just being available. I mean, COVID has put a whole nother set of challenges on all of us, right, since last March, and continues to. So I think it's, the utilization of telepsych and other services, and certainly, meeting some of the newer members like Michael Redford and others that are really doing great things in the community. I think that's the nice thing about even tonight, is bringing everybody together to talk about the services and where we go from here. So we thank you for allowing us to be a part of this, and welcome everybody.
Thank you. Thank you both. So next we have Effective School Solutions. Tonight we have Kelsey McGarvey, who is part of Effective School Solutions, and Molly Crincoli, who is our SAC, our Student Assistance Counselor, as well as the Guidance Counselor at the Alternative High School, who have been a part of the Mental Health Task Force and have met for all our subcommittee meetings to put this together. So I'm going to turn it over to Kelsey and Molly.
Hi, everyone. Like Bonnie said, I'm Kelsey McGarvey. I'm one of the clinicians with Effective School Solutions. And we're actually a really interesting program because we're not a community-based one, we're a school-based one. So I'll explain a little bit more what that means. Bonnie, can you go to the next one? So commonly referred to as ESS, or you may hear it referred to as wraparound. So since 2009, they essentially started this as a private therapeutic day school for students that just could not be maintained in the district due to mental health concerns. They quickly realized though that this model and this level of support could be placed inside school districts. So the goal of ESS is to actually cut down on the number of out-of-district placements due to mental health concerns. Next slide, please. So ESS has been with Cherry Hill Public Schools. I think we're right around 11 years now we've been partnered with Cherry Hill. So what this means actually is that we are an in-school service that provides high quality mental health support to children. Everyone in our company is a licensed clinician. And we are currently in Bret Hart, Rosa Middle School, High School East, High School West, and the alternative high school. We have therapists at each of those schools. Some have more than one therapist. And we are helping any student who has an IEP and has been diagnosed with a behavioral emotional need and who's been referred to our program. So typically there's some level of concern in school, whether we're seeing their mental health impact school attendance, their ability to remain in class. Maybe your child's one of those children that spends, a lot of time with the nurse or the guidance counselor. So typically there's some warning signs and they're referred to our program. Next slide, please. So these are just some of the things that we work on through ESS. This is not everything that we do, but we work with students that are experiencing a lot of anxiety, stress, feelings of depression, overwhelmingly sadness, poor anger management, any kind of conflict ongoing with family, peers, schools, oppositional behaviors, poor self-esteem, school refusal and avoidance, as well as substance use, poor social skills, and poor impulse control. And again, this is just kind of the tip of the iceberg of what we work with. So if you think your child could benefit from some in-school mental health services, definitely reach out to us. Through our program, we do individual therapy each week for every student that's in our program. They get a minimum of sessions per week, usually about one session for 30 minutes. We also provide group therapy, which varies on the school, but typically those students are meeting a few times a week to receive additional supports and check-ins. We provide family therapy and support groups for parents. And also an interesting part of our program that's not really seen anywhere else is our school avoidance interventions. We actually have the ability to come out to your home if your child's refusing school. So a lot of our kids actually start in our program from home. There's been a long history of school avoidance. They're not willing to come in, and we'll come out and talk with you guys, get to know the student, help that student come into the school. We do a lot of behavioral modifications plans and contracts with the student. So we're working kind of on all angles from mental health to behavioral and really trying to get your child to their best point. Next slide, please. So results, so we see some pretty amazing things every day. We're improving the quality of care for our students. We have a strong focus on academics, attendance, and discipline for students. So we basically want to reduce those things and improve grades. We want to help your child, again, be the best that they can be and really be able to focus. And we also are able to reduce classroom and school-wide disruption. So we do a lot of what's called push-in, where we may go and sit with your child or sit with their class and really provide in-class services so that we're not constantly pulling them from classes. So especially, those kids that have some strong ADHD symptoms and may need one-to-one support, we'll sit with them and help them stay focused. We'll help them get organized. A child with severe anxiety who has a presentation, we may come in and provide additional support. One thing I did want to mention that I did not mention earlier is that this service is completely free to families. It does not go through your health insurance. It does not go through the state. So it is a completely free mental health service that's provided within the Cherry Hill School District. And that's all that I have. Thank you, Bonnie.
Thank you, Kelsey. So last but not least, our next presenter is Dr. Marianne Ager. She's a psychiatrist, and I know she is a local, I think, homegrown from Cherry Hill. So I'm going to let Dr. Ager begin.
Okay. Hi, everybody. I hope you can hear me. Did I get my microphone right and everything? It's a pleasure to be here tonight. My name is Marianne Ager, and I'm a psychiatrist. I'm also a psychoanalyst. Most importantly, I've lived in Cherry Hill and practiced here for 35 years. Much of the work I've been doing has been with schools, with families and children, and especially with kids with ADHD and other learning problems. I have a little research group, and we actually do some publications about ADHD, books that kids could read to help them feel good about themselves. I'm a mom. I have a son who went through the whole district, started with Stockton, went to Beck, finished from East, and happy to say he's a smart young man these days, and I'm grateful to the schools for all of that. My talk is a little bit different than some of the other people tonight because I really wanted to speak from the point of view of someone who's been on the mental health task force for many, many years. I've been around long enough to see many changes and to see that, you know, what we need to do with our students has changed drastically over my career. You can imagine many years ago that the support we gave people in the school was very different than it is now. But this last year with the COVID has really been one of the biggest, fast changes that I've ever seen. And it's been a real stressor on mental health for just about everyone. Let's go on to my next slide. So I just wanted to show you folks over here a definition from the World Health Organization about what good mental health is. You know, people ask me, well, what does it mean to have good mental health? And some people think it means, well, you're happy all the time or everything's skippy dippy and your life is just great. That's really not true. Those of us in mental health think of people who have good mental health are people who can manage the ups and downs that they're going to have every day in life. Nobody's life is going to be perfect. Nobody's life is going to be without stress. And we're looking to help people be resilient and responsive so that, you know, they can live life well, they can enjoy their relationships, they can enjoy their hobbies, and very importantly, contribute to their community. And that's very important to us in our group tonight, because we're talking about what can we do here for each other. There are two things I want to mention about COVID, which I've listed on my slide. You know, this has been a really tough year. There's been a lot of stress. There's been a lot of change. There have been all sorts of challenges in work, at school, and social things, and educational spheres. But there's a second thing that I want to call to attention, and that is for anybody in our community who has been unfortunate enough to be ill with COVID-19. I want you all to be very, very, very aware that there is some evidence that this virus has a later effect and leads to depression and anxiety as much as 6 months or a year after having it. So I want everybody to be on guard about that. Should you have those types of symptoms and you don't understand why, remember that you had a serious illness and that you might need medical treatment. Don't be afraid to reach out. I put a slide here that's from KFF, which is a big research foundation. If you look online, they have so many different research projects they've done, and they've been looking at the population. But I like this one slide because if you look at it, it shows that younger adults, people with school-age children, like many of you listening, are feeling the biggest stress because you've got work, you've got children, you've got your parents, you probably have grandparents to worry about. You have so much on your plate So be aware that if you're feeling anxiety or depression, it's not unusual. And, you know, if you feel that you're needing expert help, don't hesitate to reach out. Let's go on to the next slide. The next one is about ways to continue to look after your mental health at home. Most of us have already been doing this, but I can't say how important it is for your mental health to know that you have a plan, that you've been providing masks, that you're using gloves, that you've taught your children. So keep doing that. You know, you want to prevent this illness and you want to know you're doing all you can to be careful. Keep up with your sleeping and your eating and your exercise. Try to keep a normal pattern. This is not easy at this time. Don't, you know, expect yourself to be perfect with this. Give yourself leeway, but try to have something that, you know, is a regular schedule. Watch out for using alcohol, tobacco, and drugs. This has been a big problem during this time. So many people are consoling themselves with substances, and we really want to avoid that. All of us need to learn relaxation, meditation, breathing, and there are so many ways you can learn this at home. You can learn it online. You can go to Comcast and probably find something about it. You might choose to go and see a clinician to learn those things. Some of the other people that spoke tonight provide these services and will be happy to teach you something that can very easily improve your life. Another thing I want to mention is keeping up with hobbies. So many people have taken up golf because it's a solitary sport and you can be outdoors. People are running, people are walking. Now as we get into the better weather, there'll be, you know, more of a chance for that. But I can encourage all of you who've been playing games with your kids and, you know, found fun things to do with them. Keep doing it, because even though we're going back to school and you may be going back to work, we still need this critical interaction. And the last thing I put on here is talk about your worries and concerns, because talking with other human beings is very grounding and healing. And if you're doing all of these things and, you know, you feel that you're, you know, not your usual self, that's no surprise. But you may get to the point where you'd like to come out and ask for help. And please feel free to do that, to reach out. Right now, we've become aware that the #1 pre-existing condition in America is a mental health condition. So in other words, that means that more of us have symptoms that need to be addressed that relate to our mental health than almost any other organ system. So keep that in mind. You're not alone and you can reach out. Let's go on to the next slide that I have. This one is just to remind you that there are lots of places in Cherry Hill. We are rich and fortunate, and we are close to Philadelphia too, which gives us access to all the latest things. Not only the other people that spoke tonight who have wonderful services, but you know, we have private practitioners who can provide almost any service you might get interested in, whether it's cognitive therapy, whether it's meditation, whether it's medication management. You know, we have it all here, and there's no reason not to reach out. We have terrific emergency services. Everybody, I think, has mentioned telemedicine, and that's really become cutting edge. It's really a wonderful thing, and it's enabled all of us to stay in touch with our patients and to help new people. I also want to mention just at the end here that there are a lot of new things going on in psychiatry and mental health. Some of you may be aware that we now have what's called medical foods. And these are actually by prescription, but they are food substances that can provide our brains the nutrients they need to function normally. And believe it or not, there are a good number of people on antidepressants or ADD medicines who don't get full results because they don't have the building blocks. So I want to remind everybody that building blocks are important and that it's something to think about in your treatment if you haven't been satisfied with your treatment or you don't want to go the medication route. Some of these medical foods are wonderful. There are things like L-methylfolate, which, you know, boosts your brain activity. The next thing I listed, just because I think it's great, is genetic testing. Genetic testing now allows us to swab your cheek and send off a test that will let us know what medications might work best for you, and also to let us know whether you metabolize, you know, some of these basic substances like L-methylfolate. If you don't and you're not able to produce them yourself, then we know we have to give them to you as an adjunct. We have in this area transcranial magnetic stimulation, which is putting a magnet on the head and giving a magnetic force. It's very brief, like 4 minutes. And believe it or not, it works as well for certain people as antidepressant medication. We also in this area have ketamine treatments, nasal and infusion, which, you know, many places don't have. So we have many things that you can explore. Just remember that in keeping yourself well, it usually takes more than one thing. It takes a good diet, it takes exercise, it takes socialization, it takes friends, it takes hobbies to make yourself feel like a whole person. And sometimes when you come for treatment, it's very similar. One thing alone won't be helpful enough. So think of not only individual therapy and perhaps medication, but also vitamins and your social group, and, you know, stick with it until you get the results you want. I'm going to encourage everybody to speak up for themselves. I think the day of feeling that there's, you know, a shyness about talking about mental health issues has, thank God, started to decrease greatly. And I would encourage everybody who feels, you know, that they would like to do more with their mental health to go on that journey, because they may find out some incredible things about themselves. And that's it for me. Thank you.
Thank you. Thank you all. So that ends, I'm going to stop sharing my screen. Okay. So that ends the PowerPoint presentation. And we are going to take time for questions from our attendees. The best way to do it is just raise your hand, and I can see who wants to ask a question. And then I will click on your name and allow you to ask if you have any questions. I do have one that was put into the chat. It asked, any practice have Asian language speaking therapists / psychiatrists? Let me actually be helpful. Let me unmute everybody here. If you could all unmute yourself, that way if you want to speak.
Not at this time. We did, and she's in graduate school, so she's no longer. Sorry.
You know, I don't know anyone offhand, but I think if you would, the person who needs to know, if you could call the New Jersey Psychiatric Society, they will find someone for you. And I don't have that number with me, but I did put my email address in, and if that person would want to email me, I can help them get in touch so we could find someone. The other choice might be a translator, and that might be a possibility.
They're usually, if you do call Perform Care for services, they also have people
Right.
speak multiple languages. So if it is an urgent need, the Crisis Mobile Response and Perform Care can come out to your home. And if you do tell them that you need a certain language speaker, they are able to provide that 99% of the time.
ESS also has access to the language line. So I only speak English, sadly. I wish I was bilingual, but that would be an option for any student and family that wanted that in-school services. We could have a language line and work on having someone translate as we go.
Thank you. Do we have any other questions from our attendees? I'll give it a few minutes. I think you guys did such a good job. And also, which is very helpful, is that you, with this presentation, you have your contact information. So if parents do want to reach out and ask maybe questions that maybe feel maybe are personal, they have the opportunity. I do want to remind those who are attending that this presentation is being recorded. So I did have some parents that said that they couldn't make it tonight, and we are putting it on the district website. There is a mental health task force, MHTF dashboard that we're able to put updated information. There's a nurse presentation up there, and the SAC, the student assistant counselor, did a recorded presentation being posted, and we'll be able to actually post this this webinar. So if anybody that you know that wanted to attend but couldn't, just let them know that it is recorded, and they can go on the district website to retrieve it and listen to all the useful information as well as the presentation. It looks like I might have a, okay. Okay, I don't see any hands or any questions from anyone. So I want to thank our panelists for taking the time. We had quite a few little subcommittee meetings on Fridays, and they took the time away from their busy schedules to make this presentation for the community, and it will be up so people can access it. And I want to thank you again, and thank you for the panelists and the attendees for joining us this evening. And feel free to reach out to anybody, to include myself, Bonnie Minjin, as the supervisor of People Services. I'm on the district website, my email and phone number. If you have any questions or follow-up or need anything as far as mental health support, we are here for the community, our parents, and our students. So thank you, everybody. Enjoy your night.